word about what's happening here. Here's what we know so far. At approximately 10:30 this morning, we had roofers who were spraying some roofing adhesive material as part of their routine normal roof repair. A small amount of that material passed into the intake ventilation system. A short time later, we were alerted of an odor inside the hospital. The affected areas were the operating room, the emergency room, and the lobby level. Now, so far, we have had a partial patient relocation in the emergency room, and we're currently assessing if other areas need patient relocation. So far, the numbers that we know are we have 38 people who have been relocated from the emergency room to other sites within the hospital that have been determined to be safe. We have 9 patients who have been relocated to other hospitals, but those patients were not relocated as a result of this incident. And we have 4 people who have been relocated to the urgent care. Now, our highest priority is our patients to be safe, our patients, our visitors, and our employees. As such, we're taking every step to ensure that everyone is safe, and that's what we're working diligently on right now. And so far, we don't have any reports of any major injuries to any of our patients, so that's good news, but we're continuing to look into that. Right now, I'd like to bring in Fire Marshal James Gray from the Loma Linda Fire Department, who will give you some other updates as well.
Hello. Currently, as PIO Yang indicated, we are monitoring the floors. We have members from the San Bernardino County hazardous material teams that are in the hospital currently with air monitoring devices, monitoring and giving us the all clear when they have that. And also, as indicated, we have patient relocated approximately 38 patients from primarily the emergency room out to the area in front of the ER and are treating them with oxygen and fresh air.
How dangerous was the situation?
This material that was sprayed on the roof is a adhesive used in the roofing industry. They were doing as they would do normally appropriately. Unfortunately, they were close to an air handling unit, and the off-gassing got into the air handling units. It's an irritant, and as a result, the symptoms that we were reported of headaches and blurred vision a little bit, nausea. That's what we found when we got here, and then where we're at now with the treatments.
How long until you get it all clear, do you think?
That I don't know. The hazmat crews are currently coming down, checking. The last I have heard, the ER is still the highest levels on their monitors. As soon as their monitors give us in a safe area, they'll let us know, and we can step down the operation.
How serious was this issue for the patients? Did anybody get really sick, or?
No, sir.
What kind of patients were being treated in the hospital?
Yeah, I don't have specifics, but we obviously are full service, what we in our industry call tertiary and quaternary care. That's a fancy term for very high-risk patient population, but we serve a very wide variety of patients. But as you can tell from the evacuation, a majority of those were in the ED, so it was people who were coming in for emergency-type situations that were primarily affected by this.
We spoke with some people who were trying to get into the emergency room. What do you tell members of the public who may need to show up at an ER? Are you taking people, or should they go elsewhere at this point?
Well, if you have an emergency situation, the best thing to do is still call 911. That's the #1 step. If you happen to be driving yourself in, I would advise that if this is the closest emergency department, then please come by and we'll make an assessment as to whether we can treat you or not. But don't hesitate just because of this, because we want to. If we can't serve you here, we'll figure out a way to make sure we take care of you. The best thing to do is call 911. That would be the best thing.
What exactly is being done now to take care of the problem?
So our biggest priority right now is to make sure that everyone is safe in the hospital. So we're going unit by unit, we're going into every area, and we're assessing to make sure that there is no risk at all and that the smell factor is gone. And then once we determine that, then we can call this all clear and wrap this up. So that's kind of our priority right now.
How many beds do you have in the hospital?
Go ahead and answer that question, Mr. Gray.
Currently, to mitigate this, currently what we have in place, as I said, is an irritant. The treatment is to get people to fresh air, and what we have currently in place now in the stairwells and with all the doors open, we're flushing the building, if you will, with electric fans, bringing in fresh air, blowing out the bad.
To answer your question, we actually have, as part of Loma Linda, we have 6 hospitals. The main hospital is behind us, as well as Children's Hospital, but we also have 4 other hospitals, either nearby or off-site, for a total of over 1,000 beds.
Okay.
Can you tell me more about this triage that you have out front there? I know that's where you were treating people, I guess, for the time being, but it looks like a lot of those folks have been taken away. is there still going to be a lot of activity in that triage, or are you going to kind of ramp that thing down?
Well, our hope is to not have people outside. So we're going to do our best to make sure that all that triaging activity takes place as fast as possible, as efficiently as possible, to get them somewhere inside the hospital. So yes, my guess is that we're going to be taking care of that as soon as we can.